Dr. Joel Aronowitz is performing innovative surgery to help breast cancer patients. Let's sit down with Dr. Aronowitz and find out more.
Well, there's a lot of exciting things going on right now, Joy. It's a pleasure having you, and thank you for coming over to find out about what's new. Breast cancer remains really one of the most serious diseases that affects women's health and their well-being, because whether you have breast cancer or not, it's something that hangs over a woman's head her whole life. The biggest advancement in my view right now that's going on that's lessening the problems associated with breast cancer is the advent of skin and nipple-sparing mastectomy. Old-style mastectomy that we've all come to worry about, that's been a curse for women for years and years, that creates a horrible scar across a woman's chest and a terrible deformity. That operation is slowly but surely going by the wayside. And because we're diagnosing breast cancers earlier, and because women are expressing their concern for the deformity of breast cancer surgery, the surgery is a lot better than it ever used to be. So the skin and nipple sparing mastectomy is the term to remember and to ask about for a woman who has a lump in her breast and is going in for a biopsy or even requires a mastectomy.
What's the difference between the two techniques?
It's very simple, really. If you think of the breast as having a skin envelope, and that's what we look at, and that's what's so pretty about a woman's breast is the shape of that skin envelope, and then the tissue that's inside that is filling up that skin envelope is where the problem is. That's really the breast tissue. It's not just fat in there and some fibrous tissue like a man's breast. There are glands inside. There are ducts that deliver the milk to the nipple. That tissue is the tissue that forms breast cancer. And that's the problem, not the skin. So this technique allows the surgeon to take out that breast tissue that's the problem, but leaving all or most of the skin intact. Well, because if you look at breast cancer as something that most plastic surgeons are intimately involved in, and if you look at the history of breast cancer over the several thousand years of recorded history, we have evidence that breast cancer has been around in every society on the planet for as long as mankind has had civilization. So it's been there. We don't know what causes it. And we have some clues now with BRCA and other things that tell us that certain women are at a higher risk, but we really don't know what causes the vast majority of breast cancers. And we can't prevent the vast majority of breast cancers. So until we can, how can we reduce the pain and suffering that's associated with breast cancer? And that's what occurred to me as a plastic surgeon, was that there was so much pain and suffering associated with the treatment of breast cancer. How can we do a better job? And the way we can do a better job is by applying the principles that we've learned from plastic surgery, from cosmetic surgery of the breast, to breast cancer. And why shouldn't we? Why shouldn't we try to do a better job cosmetically for a woman who has breast cancer? Ideally, it's a woman who has, first of all, is proactive enough to ask for it. A woman has to be strong enough or have an advocate there for her when she's sitting in her doctor's office to insist upon it. If it's a possibility, then she should have that as an option for her. It may not be for everyone, and certainly there are some contraindications that I'll talk about, but the woman needs to have the wherewithal or have an advocate there with her to insist upon it, because we're in a transition phase like right now, and not every doctor is going to offer it to women. Ideally, then, physically, it's a woman who has a small breast cancer, either doesn't have breast cancer yet, like Angelina Jolie had this operation we're talking about, ahead of time, before she developed the breast cancer. So that woman is a perfect candidate. If you don't have breast cancer, but for whatever reason you need a prophylactic operation to remove that breast tissue and reduce your risk of developing it. If you already have a breast cancer that's a small breast cancer that is not already grown up close to the skin, then the skin can be spared. If it's already grown into the skin or the breast cancer is so large that the skin must be removed to give a safe cancer operation, then it's not such a good operation. So early breast cancer or breast cancer that's not near the skin.
How closely do you work with other doctors that are doing cancer treatments?
Well, I have to work very closely because the way that we do it in America in most centers is there's a plastic surgeon who does the reconstruction, and that's me. And then there's another physician, a surgeon who does the cancer operation, who is going to actually do the skin sparing and nipple sparing mastectomy. And those two individuals need to understand each other well, and they need to work together well, because they're kind of at cross purposes and there's friction there in terms of what they need to do professionally. So they need to be able to plan things out properly and work together well so that everybody can accomplish their goal.